welcome to the deep dive. Today, we're tackling a really specific, but I think incredibly challenging hurdle in the medical world.
Okay.
The pathology section of the MRCS Part A exam.
Yes.
Now, if you're not familiar, the MRCS Part A, that's the first part of the membership of the Royal College of Surgeons exam. It's a huge step for doctors aiming to become surgeons.
Absolutely crucial.
And pathology.
Yeah.
That's the study of disease, and it's just massive.
It is, yeah. Pathology is absolutely foundational if you want to understand surgical conditions.
Mhm.
But the sheer amount of information you need for the exam, it can feel, well, overwhelming.
Definitely. Especially for busy trainees already juggling clinical work.
Right. It's often cited as a major sticking point, that section.
Absolutely. And, well, that brings us neatly to the source material for this deep dive.
Right.
It's a book called 100 Short Revision Notes for Pathology of MRCS Part A exam. It's by Dr. Atef Ahmed.
Right. I've heard of this one.
And the whole idea here is pretty fascinating. It's designed specifically for those busy medical professionals, trying to cut through the noise, streamline revision.
Yeah, that makes sense. The book seems to position itself not just as a summary maybe, but more like a highly focused, really curated approach.
Exactly.
To mastering the essentials, the pathology essentials you need for that specific exam.
That's it, exactly.
Yeah.
So our mission today really is to dig into this approach. We want to unpack what this book's strategy actually is.
Okay.
Why focus on just 100 points? Could that really be effective? And, importantly, we want to pull out some insights into what kind of crucial pathology knowledge it distills to help you, the listener, sort of grasp how a resource like this aims to simplify what feels like a really daunting task.
Okay, yeah. Let's maybe think about that challenge first.
Yeah.
Why is pathology for the MRCS Part A so tough to prepare for? I mean, you mentioned it, volumes.
It's the volume, right?
It really is. You need to understand everything from, like, the really basic cellular responses to injury, all the way through to specific diseases affecting totally different organ systems.
Right. And it's not just memorizing lists of facts, is it?
No, not a...
You need to get why things happen at that cellular tissue level to understand the clinical side, the surgical management.
Exactly.
And then trying to integrate that across every system. Cardiovascular, neurological.
Yeah.
It's just immense.
It is immense, precisely. Yeah. And that, I think, is where this idea of 100 short revision notes comes in. That specific number, 100, it signals a very deliberate kind of curation.
Like a conscious choice.
Yes. The author, drawing on experience, it seems, both as a surgeon and an educator, has tried to pinpoint the absolute core. The high-yield principles.
High yield. That's the magic phrase in exam prep, isn't it?
It really is, yeah. It means the concepts or maybe the facts that are most likely to show up on the test.
Or the ones that give you the biggest bang for your buck in understanding the subject.
That's a good way to put it. It's all about efficiency. So instead of getting bogged down in every single exhaustive detail, the book aims to focus on fundamental concepts.
Hey.
And the clinical correlations that are essential for this exam, it's basically saying, look, master these 100 points.
Right.
And you'll have a strong handle on the most important pathology for the MRCS Part A.
Okay, so let's get into that a bit more then. What kind of pathology knowledge are we talking about within these notes? Based on the book's description, anyway. It covers the big foundational areas, yeah.
It does. It starts with the building blocks. Topics like neoplasia and carcinogenesis, that's the study of how cancers develop.
The crucial stuff.
Absolutely. And inflammation and wound healing. You can't be a surgeon without understanding that inside out.
No way.
And things like immunopathology, hypersensitivity reactions, understanding how the body's immune system works, or sometimes, misfires.
Those are huge fundamental processes. What about more specific disease areas? Does it get into that?
Yeah, it then applies these basic principles to specific systems. So cardiovascular pathology, respiratory, GI, urogenital, musculoskeletal, neuropathology. They're all apparently included.
The main hitters.
The main areas surgeons deal with every day, exactly.
And the goal isn't just listing facts, you said. How does it actually help with understanding?
Well, the idea behind the design, it seems, is for each note to really capture the essential concepts, the mechanisms, and the clinical relevance.
Okay, give me an example.
Okay. Say, instead of just having a note titled acute inflammation, it would likely cover the key features. Things like vascular changes, vasodilation, increased permeability.
Right, the classic signs.
Exactly. And the cellular players involved, like neutrophils being the first ones on the scene, it connects that tiny cellular process to the visible reaction you see in a patient.
Ah, Okay, so it's boiling down these really complex processes to their absolute core bits and why they matter surgically.
That seems to be the aim, yes.
Can you give another example? Maybe from neoplasia. That's always a big one.
Sure. For neoplasia, a really high yield note might focus on the fundamental difference between benign and malignant tumors.
Okay,
It probably wouldn't list every single cancer type. That would be impossible in one note.
right.
But it would highlight the key differentiating features. Malignant tumors invade nearby tissues.
Mm-hmm.
They can metastasize, spread to distant sites.
Yeah.
And they often look less like the original tissue, poor differentiation, compared to benign ones, which usually stay put and look more normal.
Yeah, I get it now. It's picking out the defining characteristics, the core mechanisms that underpin these huge topics.
Yes.
So for inflammation, it's the core process, the key mediators.
Yeah.
For neoplasia, it's about those defining behaviors, invasion, metastasis.
Mm-hmm.
That makes the high-yield idea much clearer.
Right.
It's about grasping the principles that you can then apply more broadly.
Exactly. That's the key. The goal isn't just rote memorization of, endless details. It's about building an understanding of the fundamental mechanism.
Right.
Because that allows you, when you encounter different diseases within a system, to approach them with a solid pathological framework already in mind.
Okay.
It helps bridge that gap between, say, the massive textbook knowledge and the actual pathology you're seeing in a clinical context.
And I imagine for someone juggling shifts with really limited study time, having short, focused notes like this must be incredibly valuable.
Oh, absolutely. The format itself is designed for quick review reinforcement.
Like flashcards, almost, but with more depth.
Sort of, yeah. You can target specific weak areas or just quickly run through the essential points before an exam or even before seeing a relevant case. It's meant to be an efficient tool to use alongside your broader study, obviously, but it helps consolidate that really critical information.
Okay, so ultimately then, by engaging with this kind of focused content, what's the intended outcome for the reader? What's the promise?
Well, the book aims to give you a strong, solid understanding of the pathological basis of diseases that are relevant to surgery. And this deeper grasp, this understanding, is intended to empower you, to help you make more informed decisions, diagnostic decisions, therapeutic decisions when you're actually facing real patients.
So it links the exam prep directly back to being a better, more capable surgeon down the line.
That seems to be the message.
It's not just about ticking the exam box, but actually building that foundational knowledge you need for your practice.
Precisely. It's presented as a resource that, yes, helps you pass the exam, but also supports your long-term professional growth by really solidifying that essential pathological foundation.
Okay, I think that gives us a really good picture. We've taken a deep dive into what this book, 100 Short Revision Notes for Pathology of MRCS Part A exam, is offering.
Yeah, we've explored how it tackles that huge challenge of mastering a vast subject, distilling it down into these 100 core high-yield principles.
Right.
Aiming to connect that, theoretical knowledge to actual clinical practice through these focused, digestible notes.
And we've touched on the intended benefits too. Streamlining revision, yes, but also getting a deeper understanding of disease and ultimately helping you make more informed decisions throughout your surgical career.
It's definitely a specific strategy, isn't it, for tackling what is a pretty significant educational hurdle for many trainees?
It is. So here's maybe a final thought for you, our listener, to mull over.
Okay.
If a subject as complex, as foundational, and frankly as critical as pathology,
Yeah.
for a really rigorous surgical exam like the MRCS Part A, if that can be effectively synthesized down to its 100 most essential high-yield points,
Right.
points designed to guide not just exam success but also clinical understanding, what does that suggest? What does that imply about the power of really focused curation? About identifying the true core principles when you're trying to master any vast and challenging field you might encounter, whether it's in your professional life or even just personal learning?